Welcome, my name is Larry Capetto and this is my story. I was diagnosed with cataracts in both eyes in 2011. I suffered from blurry and ghosting vision for many years. I didn't realize how bad my eyesight was though until after my first surgery. I recently had cataract surgery in both eyes and now I'm seeing 20/15 better than I've ever seen in my life. It's nothing short of a miracle. I've not only gained my eyesight back, but my quality of life as well. This video contains some valuable information that I wish I would have had when I started my quest to learn more about cataracts and cataract surgery over 3 years ago. It's simple, practical information that I believe will help a lot of people and ease some fears too. Cataract is the hardening or clouding of the eye's natural lens and can be caused by several things including age, trauma or injury to the eye, or too much exposure to the sun's ultraviolet rays. Cataracts are the leading cause of blindness worldwide and is the most commonly performed surgical procedure in the United States. Finding the right doctor and surgeon to do your cataract surgery is extremely important. Don't just run off to anybody. Your eyes are your most precious commodity. I saw 8 doctors in 3 years and wasn't just going to let anybody touch my eyes. When I finally found the right doctor, I was able to ask a lot of questions and have them all answered to my satisfaction. Finding a doctor who will instill in you both confidence and reassurance while helping you make decisions is extremely important in this process. It's something you need to do. You need to do your homework. Finally, the day had arrived for my first surgery on my right eye. I remember feeling a bit nervous. I think the hardest part for me was fasting and then waiting for the procedure to take place after I was prepped. The actual surgery only took about 10 minutes. After applying numbing drops and dilating my eyes, I was taken into the operating room and given some medicine to relax through an IV. Before you know it, you end up in post-op. It took about 30 minutes and I was out the door. My eye felt a bit scratchy, but boy, I could already start seeing so well with my right eye. My left eye was done 2 weeks later. After my one-day post-op exam, I was seeing 20/15 in both eyes. To be able to see like I'm seeing now is an absolute miracle. Regarding the cost of cataract surgery, it is expensive in this country and hopefully you have insurance to cover it, but it's well worth the effort. To be able to see like this, you can't put a price tag on it. I was blind, but now I see, and see like I've never seen before. I'm so grateful for my new eyes. Each day is a new experience for me. I'm not just seeing the big things in life, I'm also seeing the small details. I'm not just hearing the birds in the morning, I see them as they fly by. I can see the limbs and the leaves on the trees and the grass below and the clouds passing by. When I drive my car now, I have so much more confidence. I'm reading all the license plates, the road signs, and the billboards. It's such a blessing. If you're contemplating cataract surgery, I would encourage you to get some insurance, find the right doctor, and ask a lot of questions. Bottom line, when the benefits outweigh the risks, it's time to do it. Thank you.
So this is the beginning. Tell me what we're doing.
Okay, we can see you're looking at the eye. You can see the cloudiness in the center, and that's what you're looking through. You can see how dark it is looking in, and that's a relatively dense cataract for the United States. And I'm securing your eye, and this is a diamond blade that I'm using to make. It's only about 1 millimeter, and I use that to gain access to inside your eye. And I'm going to have you look and fixate on the light. And now I'm putting, this is numbing medicine going into your eye. So we've already put numbing drops on your eye. Okay. So the only discomfort should have been a little bit
this is
putting in the clip. That's numbing medicine going into the eye to freeze the nerves.
Okay.
And now this is an artificial vitreous that I put in that I use to protect all the delicate inner structures of the eye.
Like a gel?
It's just like a little gel.
Okay.
And now I'm going to make a self-sealing incision into your eye. So this is securing your eye because it looks fairly easy, but it's actually kind of tricky to get the incision just perfect so that it'll seal itself with no stitches.
How big's that blade?
That blade is 2.2 millimeters. So I put a 1 millimeter initial opening. This is a 2.2 millimeter, but it's a 3-planed incision. So I kind of went in the middle of the eye wall for about 2 millimeters and then went in. So it's a
What did
square
you pierce? What did you just pierce?
That's your cornea.
Like the outside of the M&M?
The outside, well, no, this is the outside of the wall of the eye.
Okay.
It's the clear window on the front of the eye.
Okay.
And it's a 2.2 millimeter incision. It's a square incision. Now this is just using a needle. And now this is behind your iris, inside the eye. I'm going to try to make a circular opening in the outer candy shell. It kind of has the consistency of the skin of a grape. And I'm going to make a circular opening. And this is the one time I really like people to remain still. So I talk to you and try to have you look straight at the light and not move. Because this is tearing, and this is, as I said, much more delicate than the skin of a grape. And I'm tearing a circular opening. You can see the edge of it there. And I'm re-grabbing and making a circular opening.
Is that a piece of skin? What is that?
It's just a membrane. It's called the anterior capsule of the lens.
That gives you access to the lens?
Well, that's the outer window of the lens. It's the outer shell in the lens.
Okay.
So I've just opened that up. I've created a nice circular opening, and it's really important to have those edges intact. And that's one of the more delicate and important parts of modern cataract surgery. Now this is just using fluid to dissect the capsule free from the cloudy parts of the lens.
Okay.
And I'm injecting fluid into it and trying to get it so that it'll rotate very nicely. And now I'm going in, this is a little, I'm just going to break it into pieces.
The cataract?
We're breaking the hard cataract into 2 pieces there. And now I'm turning it, and I'm going to break it again. So now I'm breaking it into 4 pieces. And now I'm going to go in, this is a phacoemulsification probe that goes in through that 2.2 millimeter opening. And it has suction, and it also vibrates, and it's kind of like a little bit of a jackhammer.
Okay.
And it has ultrasonic power that will break up the hard part of the cataract.
When you said my cataracts were dense, is that what you meant?
Yeah.
Okay.
And so I'm going to go in, and I'm going to use a technique where I'm going to basically suck it in and then basically break it into small pieces and suck it out. So this is the 2.2 millimeter ultrasonic probe called the phacoemulsification probe.
So you're beginning to suck it out?
And I'm going to be grabbing onto the pieces. And it has suction. It's a foot pedal, and I suck. And also, and this is a second instrument that I use to manipulate the pieces into the tip. And also, and this is going in through that 1 millimeter opening.
Okay.
And I'm going to use that to manipulate the pieces into the tip, and then when they're on the tip and holding it, I'm going to use this to chop the pieces into smaller pieces.
Okay.
So I'm grabbing onto the lens and sucking it in and using that second instrument to break it into smaller pieces.
Okay. So you're sucking it out right now?
Yeah, it says very, very small motions with these instruments. So I've got it sucked down. I just chopped it into piece. And you can see how much clearer it's getting to be lighter. And so I'm just very delicately and slowly sucking it into that tip and using the second instrument to guide it in and break it up.
Is it important to get all that out?
Well, all the hard parts with the ultrasound. And so that's the end of the hard part of your cataract. And now this is kind of the chocolatey mess. It's called the cortex.
Okay.
And so you still have a little bit of cortex left. And now I'm going to, that's actually that's sort of a sharp, almost like a ultrasonic blade breaking up the hard part of the cataract. Now you can see how much brighter it is.
Yeah, oh yeah.
And now this is going to be to suck out the. This is going to be to suck out the next layer of the lens, which is called the cortex.
Okay.
And this is just purely suction. It has irrigation coming in through the tube that keeps the eye inflated.
Okay.
And I'm grabbing onto the cortex and sucking it in.
And you're looking through like a
I'm looking through an operating microscope
Okay.
at a little bit higher power than what we're seeing here. And you can see it's sort of sucking in, and now it's getting even clearer and cleaner.
And you get to a point, you know you've got it all.
Well, you can see.
Yeah,
I mean, I can
yeah,
see
that's
it.
what I'm saying. Yeah.
So I keep going until it's completely clear.
Do you think they could ever put Versed into a pill form? You told me I fell asleep during this first time. So you're vacuuming out my eye.
Vacuuming out, I'm getting the last little cells. I've got most of it out. See how nice and clear it is? And you can see that sort of nice circular opening.
That's good.
And it's all, you can see how much brighter and clearer it is. Now this is using a little of that same artificial vitreous to protect the inner structures. And we've already measured the curvature of your eye and the length of your eye. So we've been able to choose the lens power to give you the vision we want. And
I believe this was a 7.5 or minus 7.5.
Yeah.
How do you measure those?
it's just the dioptric power, which is 1 over the focal length of the lens. And I'm
This is like a grasshopper.
I put the lens in, and it's got these little flexible edges,
Is that what those
which center it into the little capsular bag. And so now I'm going to, the lens implant is in, and now I'm going to go in and vacuum out that artificial vitreous.
It kind of just opens up by itself.
It opens up by itself, so it rolls up and goes through that 2.2 millimeter opening. And then I vacuum it out. And this is just removing the little jelly I put in. I'm underneath the lens now to get all of that out. So I'm taking all of that out, and I'm just centering the lens.
How important is it to have the hinges where they are? What if they were turned like that?
Makes no difference.
Oh, it doesn't? Okay.
But there are some lenses we use that are used to correct astigmatism for people who have high astigmatism, and then the orientation is really important. But this just fits in. It's a circular little bag.
Does it have to be perfectly centered, or does it, I mean...
It centers itself perfectly in the little bag. But yeah, I want it to be perfectly centered. If it's not perfectly centered, your vision won't be quite as good. And so that's one of those little attention to details that I do. And this is just putting a little bit of fluid in to hydrate the wound.
Okay.
Now I'm just making absolutely certain of perfect centration, which it now is. And now I'll just check to make sure it's fully watertight, and we're all done.
We can see sparkle in my eyes sometimes in the mirror.
Yeah. That's just light reflecting off the artificial
It's really cool,
lens.
actually, a bionic eye.
So there, the lens is perfectly centered.
Just bunching up.
Well, that's just checking to make sure the wound is watertight.
Okay.
And that everything's absolutely perfect. And then I'm also sort of touching the eye to feel the tension, because I want to have it at a normal physiologic tension. You know, so the pressure is completely normal in the eye. And so there it is. It's watertight, and it's like we're all done.
That's it, huh?
If I say so myself, that was well done.
Hey, I think you did great.
I'm proud of my resin.
You did good. Okay. You know what?
There, Capito here. I didn't run today, but boy, did I have fun.
They must be busy.
The waiting
now.
was the
I'll
tough
call
part.
them to find out.
Not eating was hard, but you can see my eyes been dilated to max, numbed, poked, prodded. They took the cataract out of that eye. Can you tell? And I was sitting here just relaxing. They gave me a little relaxing stuff, and I asked them if they could give me a little more. So anyways, I think we were successful. I could see really well after surgery. Now it's a little blurry, but they put a bunch of stuff in my eyes. I've got drops to start for several days. Follow-up appointment tomorrow morning. Hopefully we'll be able to drive home. So very scratchy right now. Feel like somebody has played with my eye, but that's to be expected. I'm going to be okay with that. So that's about it for now from the OR at the Moran Eye Center.